Hi, I'm Dr. Rachith Krishnan, MDS in the field of orthodontics and dentofacial orthopedics. I have been in association with Unique Mentors over the span of 10 years. In Unique Mentors, we take all the courses listed below for dentist, dental specialist, as well as dental assistant. In today's video, we'll be discussing certain doubts and queries which my students have asked me over these years. To begin with, the first question is regarding the eligibility after BDS. In Western countries, you can immediately apply for licensure exam after your BDS. But in Middle East, you require 2 years experience after BDS and 3 years experience after your MDS. In recent news, it has been announced by Qatar government regarding a requirement for 5-year exam to appear for licensure exam and to work in Qatar. Now the second question is BDS from India accepted or not? They are definitely accepted, but it requires an additional clause. Either you have to do a collateral education that is in US, or you have to go for a qualification licensure exam, and after that you can work in the public or private sector. Can internship have been counted as an experience? No, internship is definitely not considered as an experience. All your experience, if you're adding in your resume, will be immediately after your BDS course completion, that is after your internship. The next question, after completing the process, can we apply for job immediately? Definitely yes. Now a question by specialist. What is the minimum experience? Now let me clear it first. For specialist, your MDS is valid only in Middle East countries, and there a minimum experience of 3 years after your MDS is a mandatory clause. But in Western countries, most of the countries does not accept MDS qualification taken from India. The next one is regarding the salary packages. The salary packages for various countries is totally different, which will be listed. Now a question by dental assistant. Can a fresher dental assistant apply for job? Definitely yes, but again after your course you have to appear for a licensure exam which is available for their respective countries. Another question for dental assistant. Is there any opportunities in Gulf countries? Definitely, as the government mandatory requires that all the dental assistants, those are in the clinic or in hospitals, should complete a licensure exam specifically for dental assistant. Now Australian Dental Council exams. Just like Middle East countries, there are a lot of opportunities for candidates from India appearing for Australian exams. Now why do you need to opt for Australian exams? For better lifestyle, work-life balance and good salary packages. Now let's discuss some of the questions that many of my students ask regarding ADC exams. How many attempts are allowed for ADC exams? After your initial assessment, you have 3 attempts for the written exam, and once you clear the written exam, you can take how many attempts ever you want for your clinical exams. Now the second question, what about the exam centers for part 1 and part 2? And is there a time limit between part 1 exam, that is the written, and the part 2 exam, that is practical? Now exam centers for part 1, that is the written exam, is available all across the globe, including India. You have exam twice a year for the written exam, but the practical exam, which you have to take within the 3 years, is available only at Melbourne centers. The third question, what about the question pattern? For the written exam, there is 2-day exams. In the first day, you have 2 papers, and the second day, you have 2 papers. In the first day, it is about the information gathering, that is paper 1, and the paper 2 is professionalism and health promotion. The second day written exam is regarding the diagnosis and management planning. The fourth paper is clinical treatment and evaluation. So once you clear these 4 papers, within 3 years you have to write the clinical exam, which has 10 questions, and each question may range from just a diagnosis and evaluation to an OSCE patterned exam, that is objective centered clinical evaluation, which may be just taking an x-ray or doing a tooth preparation or doing an access opening or even doing an emergency resuscitation procedure. The next question is, what is the total duration of the entire ADC process? As you know, the written exam is twice a year. Before that, you have to do an initial assessment. So initial assessment after uploading the document will take 8 weeks for verification. Then you can appear the exam either in March or September. And once you clear that, anytime the dates for the practical exam will be announced and you can appear for that. So an average of 1.5 years is the time period which may take for the entire completion of process, including the initial assessment. What is the average salary of dentists in Australia? The salary is based whether you are working on a public sector or private sector and based on your experience. A fresher in private or public sector may get up to 6,000 to 8,000 Australian dollars. That will be approximately 3.5 to 5.5 lakh per month. Now, as the experience increases, so a 3 to 5 years of experience may earn up to 11,000 Australian dollars per month. And if you have an experience over the 5 years, your salary may exceed up to 20,000 Australian dollars per month. The final question is, what is the final registration process? Once you have completed the clinical examination, you have to register with the Dental Board of Australia through AHPRA. That is an association through which they will allow you to register with the Australian board, and you can freely practice in private sector, public sector, and as well as involve yourself in research, post-graduation programs, scientific programs, and all. So those were the questions, and for further doubts you can either contact Unique Mentors or post your doubts in the comment box. Thank you.